investment?
Well, as you go forward, we'd ask that while you're looking backwards and plugging the holes, that I would like to just add emphasis that the working group give consideration to where we really need to be going forward on early childhood education. Thank you.
Thank you.
Thank you. Mr. Ting?
Thank you, Mr. Chair. And just to piggyback on the comments from my colleague from Richmond, so it seems like, at least for CDE, it appears the full day rates aren't anywhere close to where they need to be to actually utilize it. So I guess given that, what is the path that we can go to actually go increase those rates so they could be utilized? I have the same assumption that my colleague does. Is I would assume there'd be a 80,000 family wait list for full day slots. Childcare is an extremely important issue for me personally as well. I know that if it wasn't for the preschool that my younger daughter's in right now, either my wife or I wouldn't be able to work. And that's just the reality. I think we were in a more fortunate situation where we could actually pay the exorbitant San Francisco childcare slots, which were, much more than what I paid to go to UC Berkeley. And nowhere near as good the education. But kind of given that, I guess, so a couple of things. You see, I totally agree with Mr. Thurman. We need to find ways to increase revenue so we can bring back those 100,000 slots. That's the goal. So let's never lose sight of that. The short-term issue that we have in front of us, and this is sort of the question I pose, which is actually the decision that our subcommittees will have to deal with, is where do we spend the limited amount of money we have this year, which is, do we add slots? Do we put all the money to reimbursement? Do we do a hybrid? I know in years past, the Assembly approach has been to try to really go after reimbursements, I think partly to tackle this issue that CDE raised. So I would love to hear your advice, because that, frankly, is the decision in front of us. I think we have a longer-term goal that we all are 1,000% in favor of, which is we need more money so we can bring back those 100,000 slots. But we need to make sure those 100,000 slots are in facilities that are paying their workers a living wage. I mean, that was the other shocking thing. Given how much I was paying, I was shocked to find how little all these amazing teachers that were taking care of my two daughters were getting paid. I was just shocked. I mean, because here we were. Our facility was a city hall where I used to work. So on top of the city provided the real estate for free, and we were paying a lot of money. And then I would hear how little the care providers were getting, and so many of them were moonlighting as babysitters to actually earn more money. So again, help us. I'd love to hear your thoughts about how you would sort of navigate that decision.
So I just want to add one point. I think the problem is we have a rates problem across all our programs, right? It's not just preschool. It's all our programs where we're seeing this problem. In addition, the only other thing I would add is we've had a minimum wage increase, which is fabulous, right? But that's really put the crunch on these providers. They haven't received any rate increases to absorb those.
To piggyback.
So just sorry, before Ms. Gable goes in. So I guess kind of given that, what's the right way to go about increasing those rates? I mean, I think you assess the problem very well, but I guess what's the path that we can go to actually get those rates to where they need to be, especially because, again, I'll just be selfish for a second, talk about San Francisco. We're increasing our living wage, and it's not even a living wage in San Francisco. I mean, my philosophy was whatever we put on the ballot was actually not enough. Whatever the number was going to be was not enough. And that's the bottom line, to live in our really expensive city and region. But having said that, I guess how do we get the rates to really kind of start to move in that direction?
So we can come back with you with kind of some options. I don't have options for you today. I think our suggestion would just be a combination of the two.
And if I might piggyback on this, because the rate issue has been one that's been discussed for many years, and a policy issue that has been discussed in policy committees and before these subcommittees in the past is the issue of rate reform as well. And we have a standard reimbursement rate that, because of the number of years that it's been since it's ever had any kind of investment in it that made any sense vis-a-vis the market. It's completely divorced from reality of what it takes to offer high-quality childcare in almost every single community in California. Then we have our market rate that is the RMR that's for other programs that has been so also underfunded that we're on the 2007,
I'll just stop there.
2009.
Our next panel, we're
right,
having
so
a
you'll talk
robust
about that more.
Discussion on rates.
So yes.
Yeah. So, Ms. Grove.
Thank you, Mr. Chair. I'm just trying to understand the rate, and I'm sure my colleagues get this, but I'm just trying to understand it so I can make an informed decision. So if you have a contract with the state under SRR, is there a medium funding or is it just an actual funding? For instance, there was examples given by the LAO's office that Kings County $710, Marin County $1,124. Those are not under contract. That's a voucher. But when you look at other counties separately, is it a medium funding or is it an actual funding based on that county's, cost of living?
So under the contracts, when we contract directly with a provider for state preschool, then we pay them all the same rate per child enrolled in the program. So on our handout on page 5, for those programs for a 4-year-old, we pay $752.
No matter where they're at?
No matter where they are. For the voucher programs, the rates vary, and moreover, they vary based on what the provider charges. So in our example for Kings County, where the maximum the state will pay is $710, if I chose a provider that only charges $600, that's all the state would pay. The regional market rate just sets a ceiling on the value of the voucher, and it varies for every county and the age of the child. But under the standard reimbursement rate, everyone's paid the same for every single child.
So if there's a county under contract with the state, the standard reimbursement would be $752, regardless if it cost them $500 a month or $600 a month, or more in different counties.
That's right.
So one of the comments that was just made, that minimum wage increase has cost providers to actually have to pay more. My colleague from Richmond asked you to think about a special formula or whatever to move forward of where we should be in 20 years, 10 years. He said 20, but 5, 10, 20 years. If they're successful in unionizing childcare and the cost increases goes up, can you guys throw in the number what you think that cost would be to the state if that was to happen? Or do you anticipate the state being exempted from that?
Well, so maybe I could answer it in 2 pieces. Okay. The first being, there are some options in your agenda in terms of what it would cost to update the regional market rate. That doesn't capture if we moved the standard reimbursement rate programs onto the regional market rate, started acknowledging that these programs have different costs across different counties. So there would be some additional costs to those cost figures. In terms of if childcare providers if there was legislation to enable childcare workers to unionize and they did so, it's possible that would mean that there would need to be additional increases to the regional market rate. Though the earliest or the most recent regional market rate that we have is the 2014 regional market rate, and in your agenda, the cost to update to that would be $371 million. Roughly.
But what we have in our numbers are 2009, correct?
Yes, currently we're at 2009.
Okay.
If we were to update to the 2014 survey, the most recent data we have regarding prices, it would cost roughly $371 million. So in terms of the outer bound cost for updating the regional market rate, that's sort of what we know, and probably as far as we could estimate in terms of the impacts of a union negotiation.
So break that down for me, because we're operating, I'm trying to just do the simple numbers and what we have in front of us. So if you had to increase it by $371 million, what does that do for your voucher rate from 710 to 1124?
So it varies in every county, because that cost estimate is based on setting every county's reimbursement rate at the 85th percentile of the distribution of prices. So every county's rates are moving at different speeds. The percent increase is moving for every county differently. So in San Francisco, for instance, the price may have increased 20% between 2009 and 2014, but in Merced County, it only moved 12%. So it'll vary for every single county, but it would move those reimbursement rates up. The relative difference between Kings County and Marin County might be a bit different. We could get you the exact figures in terms of reimbursement rates by county.
So what would you anticipate the SRR rate, which is the standard rate that everybody gets if they're contracted with the state?
So they would not be affected by a regional market rate update. Last year, the state provided a 5% flat increase to the standard reimbursement rate. The state could do that again, and the cost of that is actually also in your agenda, so I can find it for you here. To
Next issue.
provide.
Yeah, we're going to get
What's
into
the next
we're gonna-
issue?
we're still on the
Yeah.
rates. We have a
So I
different
guess
panel.
the last question that I have for you is if the state doesn't increase that $752 by 5%, what I guess I'm relating it to Medi-Cal and those kinds of things. Okay, doctors are refusing to service Medi-Cal patients because the Medi-Cal rates are low. And if they refuse to service those patients, then those patients don't get care. So if people refuse to provide child care that's being reimbursed by the state on an SRR rate because the rate is so low,
Right.
how are we helping this situation versus not fixing this situation is what I'm trying to I realize that we have problems. I realize we have problems with the healthcare issues. I realize we have problems with this, but I don't want to throw a Band-Aid on it. I want to get to the root cause, and I want to solve that problem so that we don't have to keep throwing a 10%, 15%, all these increases on it on an annual basis, going from whatever something million to 371 million. And my colleague from Richmond, I didn't mean to call your name out. I apologize. My colleague from Richmond has the same concerns about, where are we going to come up with the funding if this keeps going in that direction? So I'm in the same ballpark.
So the problem is quite akin to the Medicare analogy that you make, is that if the reimbursement rates aren't adjusted and providers are unwilling to take on additional slots, then the state can't expand access. Then there won't be an ability of the state to provide more care.
But if there's no money to take on the additional slots, what's the solution?
Oh, the additional slots
Or the money.
or the rates. Well, I mean, in that case, the field, I think, who will speak on future panels will talk about whether or not they'd be able to continue to provide services.
Thank you very much. Sorry.
Okay, so before we get to the next panel, just the big picture here is, we're looking to do something significant in this year, and if you look at whether or not we're trying to address childhood poverty or address the achievement gap, we see no better way to further invest in early education. And so that leads to the bigger question is that if we want to follow the budget, essentially blueprint from last year, which is looking at focusing on state preschool, mind you, for a few seconds, focusing on the low-income 4-year-olds, if you include that kids that aren't in TK, Head Start, or state preschool, is coming up with a number that is out there that we're looking to serve and trying to see what issues and what challenges we have. And so basically, I know we addressed this a little bit earlier, but are there any specifics that we think from the Department of Ed that we need to look at as far as capacity and issues and potentially one-time funding to make sure that we can fulfill the potential promise of last year's budget and to serve all families who are low-income and 4-year-olds in the system?
So I think we don't have a comprehensive plan of all the issues we need to address to get there. We know facilities was an issue, and we know that rates have been there, and we're attempting to kind of get a better picture of where we are. But we don't have a comprehensive plan of all the things that we need to get to the goal, essentially, of last year's budget promise at this time.
Okay, but if there are some specific things, we certainly know that, for example, in Prop 98, we will have potentially one-time money available. So if there are issues that we think need to be addressed, knowing that last year we saw that there is a big demand out there. So with that, if we know there are X amount of families that we know aren't being served, and I know the estimates are for 4-year-olds per se from 30,000 all the way up to 50,000, would you think that the state should offer those as full day slots or part day or a combination based upon what you saw last year? Do you think that there's essentially knowledge from the lesson of last summer and the fall, which would be helpful to us as we go forward and finalize the 2015-16 budget?
So we've made a commitment to do, I think what you're requesting is some analysis of the 4,000 expansion slots in preschool, surrounding kind of where it went and how it was. And once those awards go out, we'll be able to provide that information, some more of that information about some of the need and where.
But just intuitively, what are you all thinking in the Department of Education as far as where the need is versus? So if you put all in part day and not full day, would that be a bad thing? Should you have some type of combination? We saw last year, we saw one more than the other as far as what people asked for.
Unfortunately, I think it comes back to the rate structure. and it comes back to rates. And a lot of folks, I think, would provide more full day and full year programs if the rates were there. Unfortunately, a lot of programs who want to provide that are just financially not able to. When they
Yeah, but
look
that's
at the
focusing
numbers.
on this. So I mean the families. What do they want?
The families need full day, full year.
Mm-hmm.
I mean, we've heard that, and we'll probably continue to hear that. And so that's what the need is. The need is for full day, full year.
Okay. So with that, we will bring up the panel talking about rates.
Families need options. We need options. We need options to meet all the diverse needs of our scheduling and our children. We need options. All families need options. Parents have unrealistic expectations, and children have a diverse needs that need to be met. So having options to choose from, as opposed to a constrictive, option, is not helpful. We need variable options.
Thank you. Okay, thank you. The next panel on early education and child development rates. Okay, good morning. First, we have Michael Olenek, Child Care Resource Center.
Obviously, that would be me.
Go ahead.
So I'm Michael Olenek. I'm president and CEO of the Child Care Resource Center. We're a large child development agency serving resource and referral. We do all the subsidy programs, Head Start, and home visiting, and we serve about 45,000 children and families in northern Los Angeles and San Bernardino County. Our mission is to cultivate child, family, and community well-being. Our subsidy program, and that includes Stage 1, 2, 3, General AP, Family Child Care Home Education Networks. We serve 17,500 parents, 13,000 are employed, and 4,500 are in school or in training. We distribute about $99 million in child care subsidy, and those parents earn about $232 million. That's a return of about $2.35 for every dollar spent on parents' earnings. So you heard some of the discussion already in the previous panel about rates, and I'm going to give you more details probably than you ever wanted to hear. But it's a really complicated area. Every 2 years, the state, as you heard, is required to survey the child care market and determine regional market rates. The most recent survey was just completed in 2014, and those rates are published for licensed centers and family child care homes. The survey publishes rates by age groupings of infants, preschoolers, and school-age children for both the centers and homes and for all 58 counties. And they include the hourly, daily, weekly, monthly, full-time, and part-time rates. And they also list the rates at the 50th percentile, the 75th percentile, and the 85th percentile. And so when you ask the question of, so what does this mean for your particular county? Well, there's 6,264 different rates that you can find in that RMR survey. The legislative intent for subsidized care is to fund eligible families to ensure that they can access 85% of the child care market. So the RMR that we receive from CDE sets for us a ceiling at the 85th percentile for what we can pay providers. Since my agency operates in 2 counties, I thought I'd share with you some of the results of the adjustment from the 2004 survey, which was used until January 2015, and then the 2008, which was implemented with a negative 10% factor. And I thought I'd compare that to where the market is now. As of January 2015, when we were given the new rate schedules, I'm going to report that for infant, toddler, preschoolers, and school-age child care for LA and San Bernardino, where LA is a high-cost county and San Bernardino is not, for family child care providers, there was no increase for any family child care provider with the rate increases that were included last year. In LA County, the only rate increases for family child care homes was $26.10 a month for those who are taking care of preschoolers. San Bernardino centers saw their monthly rates increase by $90 for infants, $72 for preschoolers, and $8.75 for school age, which is hardly sufficient to cover the 10 years of cost increases that providers have been experiencing. In LA, the center rates increased by $208 for infants, $107 for preschoolers, and $17 for school age. But when you compare that, the rates that we can pay now compared to the market rate, the market lagged what we can pay to family child care providers lagged behind by an average of $168 per month, and for centers by $230 per month. In LA County, the centers lagged by $346 and family child care lagged by $224 per month. In effect, parents who were looking for child care and would pay with a voucher could only choose from less than 50% of the market, not the 85% of the market that they could choose from if they could get to all that. So we also looked at how much those parents were earning on a yearly basis, and the parents earn about $1,478 a month. So to purchase a licensed center at the 85th percentile, a parent would have to spend 26% of their income for each child in order to be able to make that payment. The difference between what we can pay and what the 85th percentile is. There's been a considerable discussion about the importance of high-quality child care for low-income children. And there's the old maxim that you get what you pay for. Low-income parents can't afford the cost of high-quality care. Providers have no incentive to improve their craft since they don't receive adequate funding as it is, and whether they offer a high-quality program or have a PhD in child development, they receive no additional funding than a provider who meets the basic health and safety standards. So the state should be setting a goal that most, if not all, children experience quality child care, not just those whose parents can afford it. 60% of parents have no choice but to work full-time, and that's a figure that has not changed for over 30 years. Parents need to be able to have choices regardless of how poor-paying job they have. The state needs to increase the rate that we are allowed to pay, and incentives need to be built in so that providers have motivation to improve their craft. Thank you.
Robin Layton from Educational Enrichment Systems.
Thank you. I'm Robin Layton from Educational Enrichment Systems, and I've served as president and CEO in San Diego for the last 30 years, and we're a nonprofit organization that offers low-income working families the opportunity to become self-sufficient by providing children with full and part-day quality early education and care. The California Department of Education has contracted with EES since 1979 to educate over 1,100 students a year at our 22 Title V centers. EES utilizes a research-based curriculum that is designed to meet the social, emotional, physical, and educational needs of each individual student and features instructional practice that is culturally and linguistically tailored to fit the needs of the families and the children served. Most early education teachers choose a career in early childhood education because they love children and believe their work will foster excitement about learning. They understand that an early education is the foundation for academic success and believe passionately that every child deserves high-quality education. Yet, as we've been discussing and you've been hearing, the reimbursement rate to the Title V programs where these teachers teach undermine the ability of some early education centers to operate effectively. Title V centers are the lowest reimbursed licensed provider by our state, yet they are the only program subject to higher educational standards. The chart I provided, which we can discuss later, demonstrates as an example in San Diego, the teacher-to-student ratio at Title V centers is 1:8, whereas the state only requires a 1:12 ratio at Title 22 centers. Teachers at Title V centers are required to have twice the number of early education units than their Title 22 counterparts. Further, at Title V centers, teacher qualifications are higher, as are the standards for student assessment, and program requirements. There is not a single area in which a requirement for Title V early education centers are not equal to or greater than those for Title 22 centers. The lopsided reimbursement rates create very real problems for Title V centers like EES. When our state reimbursement rate is as painfully low as it is, it means salaries hover just above minimum wage for teachers. As a result, we have a turnover rate that significantly impacts our ability to create the stable and consistent environment our children deserve. I have seen far too many tearful resignations where teachers tell us that they love their work but cannot afford to continue working at our Title V center. They can no longer subsidize the schools by accepting these low wages. If our society truly values the work of early education teachers, we must create economic equity so centers like EES are not training grounds with a revolving door. Our children deserve better. Providing EES staff with professional wage is good for the children, the agency, and the staff. Nowhere is that more true than at EES, where families face economic instability and often turbulent home lives. Jeanette, for example, mother of 4-year-old Gavin, was recently featured in the New York Times as a low-wage worker at Starbucks, struggling to make ends meet. In the last year, she has lived in 3 different homes, including sleeping on a friend's couch. The 2 things that have remained constant in Gavin's life are his mother's love and the quality of care from EES. As much as EES has done for the children, the future workforce, I know the quality of care could be even better if we could recruit and retain top-level talent. To attract and retain the best teachers, we must offer competitive professional salaries. The studies aren't ambiguous, they don't conflict. They show convincingly that an early education improves outcomes for students, for school districts, and for communities. So I'm reaching out to you on behalf of EES's 150 teachers, 1,100 low-income students, and their working parents. And I urge you to demand pay equity for early education teachers at Title V schools. We have the opportunity to invest additional critical resources where the return on the dollar is the highest in our youngest children. Students and their low-income working parents in Title V centers deserve to have professional paid teachers that stay, not a place that pays minimum wage and has a 47% turnover rate. To solve this, we actually have a solution. We are requesting an investment that increases the standard reimbursement rate from the $36.10 per day per student to at least the current market rate, which, as you can see from the chart, in San Diego in 2009, the market rate was $64.28. Increasing rates will increase quality, and if the rates are increased, our quality will increase, and our organization will serve more children. We did not apply for the new funding because we cannot afford it, and our teachers can no longer continue to subsidize the child care for these students. Thank you.
Thank you.